Okay, as for Helicobacter, تعرفوه أكثر باسم H. pylori, Helicobacter pylori, which is a main cause of gastritis and obviously peptic ulcer disease. Infection with H. pylori is a risk factor for gastric carcinoma, and is linked. This chronic gastritis is also linked for a type of lymphoma called mucosal associated lymphoid tissue, maltoma. So this is where does the peptic ulcer disease happen? It can happen in the duodenum mainly and in the stomach. So both are there. عادة the stomach, there are other issues that can cause peptic ulcer, but عادة peptic ulcer in the duodenum is mainly usually exclusively مثلا تحكي عنها انها H. pylori. Helicobacter شو شكلهم؟ They are curved gram-negative rods similar to appearance to Campylobacter. In particular, Helicobacter are strongly urease positive. This is extremely important in الامتحانات, extremely important in diagnosis. Urease positive organism in the upper GI tract. Very important. So where Campylobacter are مثلا urease negative, and that's how you can differentiate between حتى the presence of H. pylori is just by urease positivity. So this is what it looked like. Remember we talked about how it looked like a noodle soup, lots of gram-negative curved rods. Pathogenesis, clinical findings. شو راح يكون H. pylori attaches to the mucus secreting cells of the goblet cells of the gastric mucosa. They break down this gastric protection and then they cover themselves to prevent the acid secretion. فبصير عندنا عادة لما يصير في عندك هذا infection بصير يحاول الجسم يعمل to produce a lot of acid to try to take care of this organism, but this organism will produce a large amount of ammonia from urea, which leads to the damage of mucosa and then neutralize the acid around it. بصير مثلا واحد عنده indigestion, بصير عنده معه حرقة بالأكل بالمعدة. This is probably one of the symptoms of gastritis. So the loss of the protective mucus coating predisposes to gastritis and peptic ulcer, and this can over time can also become mild lymphoma. The ammonia كمان زي ما حكينا neutralizes stomach acid, allowing this organism to survive. وبصير الجسم يزيد الأسد أكثر وأكثر, وهذا بصير تعمل أكثر وأكثر, and then other areas around this stomach will become more prone to the acid, to the high amount of acid. بصير عندهم gastritis, تنتقل البكتيريا من هاي النقطة لهي, بتصير تعمل من حواليها more than one ulcer, وهيك بصير تعمل تكبر. Epidemiologically, most patients with these diseases show H. pylori in biopsy specimen of the gastric epithelium. The natural habitat of the H. pylori is the human stomach. It is probably acquired by ingestion. إلى الآن ما بنعرف 100% من وين بتيجي H. pylori. A lot of حكي بيحكي مثلا عن leafy vegetables, مثلا سبانخ, خس, هالأشياء الخضراء. It's not washed properly. في ناس بيحكي لك there are other مثلا not very well cooked vegetables, other vegetables, وهكذا. بس what we do know إنه it's not from dairy, and بالعكس dairy is protective. الناس بيأكلوا حليب, يشربوا حليب ولبن, خاصة الأشياء اللي فيها البكتيريا عادة هذه بتحمي من H. pylori. It has not been isolated from stool, from food, from water or animals إلى الآن. Person-to-person transmission probably occurs because there is a clustering of infection within families عادة. فكانوا عشان هيك يفكروا بالزمانات إنه peptic ulcer disease is stress induced by stress, وهو فياته familial origin, فمنه مثلا it has a genetic predisposal. يعني حتى أنا لما كنت طالب, يعني not that long ago, about 10-12 years ago, كانوا يحكوا لنا بعد الجراحين هذول كانوا قدام, كانوا يحكوا لنا هذا الحكي. يعني they still had that old information, and they were still, حتى كانوا هذيك الأيام لساتوا كانوا يعملوا عمليات جراحية للبeptic ulcer. يعني طبعا هذا this is not heard of since the 90s. Because now we know it's a bacteria and it is treated by antimicrobial, بتروح البeptic ulcer وخلاص, يعني بدناش جراحة. بحكي لك مثلا الجراحة دائما بتعيش على the poor advancement of science. فإذا كل ما تقدم العلم صرنا نعرف عن diseases أكثر، كل ما بيكون اعتمادنا على الجراحات أقل. فمنها هاي يعني the main example هو كان ال H. pylori. And you know H. pylori is the cause of peptic ulcer disease. peptic ulcer disease يعني it's huge big problem. طبعا كتير فياته جراحة وماني وعمليات وناس تشتغل وناس رايحة وناس جاية. So obviously يعني there was resistance. فالطبيب اللي هم الطبيبين، طبيب وساينتست اللي اكتشفوا ان اتش بايلوري اثنيناتهم اخذوا نوبل برايز. فكانوا ينشروا ويحكوا انه peptic ulcer disease هذا المشكله الكبيره اللي احنا العويصه عايشين فيها it's probably caused by a bacterium. الناس كانوا يضحكوا عليهم، يعني they were ridiculing them انه هذا مش طبيعي. فهو شو راح عمل هذا الدكتور؟ راح اخذ culture of H. pylori وشربه. اول شيء عمل لحاله اندوسكوبي انه ما معي شيء، راح شرب هذا الكلتشر، صار معه جاسترايتس، صار معه بيبتيك ألسر، اخذ منها خزعات ورجع انه هاي this is the same bacteria that I ingested. بعدين اخذ انتي ميكروبيال وراح على البيبتيك ألسر كله. من هاي يعني باخر الثمانينات I think was the story of how peptic ulcer disease was the pathogenesis was discovered, and وهذول راحوا اخذوا Nobel Prize for their discovery. Now, gastritis and peptic ulcer are characterized by recurrent pain in the upper abdomen, frequently accompanied by bleeding into the GI tract. Now, there's no bacteremia or disseminated disease that occurs. عادة هلا بنجي هذا ايش شوي. Mouth lymphomas are B-cell tumors located typically in the stomach, and they occur elsewhere in the gastrointestinal tract. H. pylori is often found in these mouth lesions. And the chronic inflammatory induced by this organism is the one that stimulates the B-cell proliferation and eventually B-cell lymphoma. Antibiotic treatment هاي كتير النقطة كتير حلوة. Antibiotic treatment direct against the organism often causes the tumor to regress. So this is one case where antimicrobials can treat as a treatment for cancer. Lab diagnosis: the organism can be seen on gram stain smears as gram-negative بالgastric mucosa عادة جوا أو خارج الخلايا. It can be cultured on charcoal-based media, مثلا such same as Campylobacter. It is urease positive. احنا عندنا مش كتير بيستخدموه أو بلش يستخدموه الناس. في شيء اسمه urease breath test. بعطي أنا للبني آدم حبتين تكون فيها radioactive labeled urea، بيشربهم أو بياكلهم، ببلعهم مثلا وبيشرب وراهم مي، بعدين بحكي له breathe in a tube. هلا اذا كان الاورجانيزم عنده بالستومك بخليه يقعد شويه، and then if the organism in his stomach it will use this urea, it has urease, it will produce radio labeled CO2. بحكي له breathe in the tube، بعدين بمودي هذا التيوب. if it has radio labeled CO2 معناته the urea has been broken down by urease، وهذا مثلا this is a diagnostic and a follow up for this disease. احنا عندنا اكثر شيء ناس بيستخدموه هو سيرم and stool antigen، واكثر شيء ستول انتيجين. نجيب بيحكوا لك مثلا التشخيص، انه مثلا بيحكوا مثلا بدنا مثلا عينه براز بيعملوا عليها ديتكشن، بيحكي لك ما عندك بسموها شو نسيت والله شو عندنا شو بسموها ما بعرف لها اسم بيحكوا لها كثير عندنا الناس. anyways جرثومة المعدة، من ما عندك جرثومة المعدة بيحكوا له مثلا بدنا عينة براز عشان نشوف اذا عندك جرثومة. Treatment and prevention: the concept that underlies the choice of drugs is the use of antibiotics to eliminate Helicobacter plus a drug to reduce gastric acidity. The combination هدول اسمه two antibiotics used because resistance especially to metronidazole has emerged. هذا هم يسموه عادة triple therapy. So the treatment of duodenal ulcers مثل with antimicrobials, amoxicillin, metronidazole مع bismuth salt عادة it greatly reduces recurrence rate. Tetracycline can be used بدل amoxicillin, clarithromycin as well. So the triple or quadruple therapy هو عبارة عن anti acid plus 2 antimicrobials. عادة amoxicillin, clarithromycin مع PPI مثلا omeprazole, doxycycline مع clarithromycin كمان, metronidazole, bismuth salts, clarithromycin. There are more than one combination. This is the most common combination: amoxicillin, clarithromycin plus PPI. So في one issue إنه مثلا بيجي بامتحانات is not mentioned here إنه the symptoms improve with or do they improve or not improve with food. عادة if the ulcer is in the stomach, as you eat, you're going to produce a lot more acid. Okay, so as you eat, you're going to produce more acid. So the ulcers in the stomach will flare up, and you will have more symptoms. On the contrary, the ones that are in the duodenum will feel better with food. This is a common question as well. Okay. So now, pathogens that are usually only outside the enteric tract. Klebsiella, Enterobacter, Serratia. So these cause nosocomial infections such as pneumonia and urinary tract infections. Very important. Key pneumonia is an important respiratory tract pathogen outside hospitals as well. These are called opportunistic pathogens because they cause infections in the nosocomial setting because we give them the way to reach tissues that otherwise they will not be able to reach. Patients with key pneumonia عادة شو بصير عندهم؟ They have predisposing conditions عادة advanced age, alcoholism, chronic respiratory disease, diabetes مثلا. So and then it is عادة is present in the respiratory tract of about 10% of healthy people. Even though that is هذا النسفوغرافي is not normal, it should not be there as well. But they will be prone to pneumonia if their defenses are lowered. Important properties. They are species most involved in these human infections. They are frequently found in large intestine, but are also present in the soil and water. عادة these have similar properties and are usually distinguished on the basis of several biochemical reactions and motility. مثلا pneumonia ذكر حكينا has a capsule but it's not motile. Pneumonia has a very large polysaccharide capsule which gives it this mucoid appearance. Very شفتوه أكيد أكثر من مرة إلى الآن. It is most significant of these pathogens and the property is related to antiphagocytic capsule. Serratia marcescens produces red pigment colonies. هاي كمان نقطة كثير مهمة. بجوز أهم النقاط هنا إنه Klebsiella is من كثير من الأنواع اللي بصير عندها من Enterobacteriaceae that have carbapenem resistance. Carbapenem resistance نذكر حكينا this last line of defense drugs are commonly acquired by Klebsiella. بما إنه has a nosocomial problem, بصير إنه this is a nosocomial antimicrobial resistant pathogen. This is a very important property of Klebsiella. Clinical findings: UTI and pneumonia. These are the أشياء اللي عادة نشوفها with these bacteria. Bacteremia secondary to spread can also be seen, can spread to the meninges and to the liver. It's difficult to distinguish these three organisms on clinical grounds. عادة الكرن بسموها بسيز نيمونيا إذا حابة كليبسيلا بسموه كرن جيلي. كرن جيلي اللي هو يعني اللي هو التطلي or الجام or whatever أو الناس بسموه كمان جيلي. So يكون مثلا من نوع it's kind of berries. عادة لونه مثلا أقرب إلى مثلا الأحمر الغامق مثلا. So this is called currant jelly. So this sputum looks like currant jelly because of the blood and the thickness of the capsule that are produced by Klebsiella. So currant jelly sputum is common. Common. It can be seen with pneumonia with Klebsiella. Necrosis and abscess formation are also common for Klebsiella. There are two other species of Klebsiella: Klebsiella oxytoca and ozina. But oxytoca تعمل عندنا infection by humans. Ozina is not really that prominent, but can cause also atrophic rhinitis. High Serratia, the red pigment of Serratia, كتير مهمة. Arrow points to this. هي الcolonies. شوفي this gives you this pigment. This is the current jelly sputum produced by Klebsiella. Now, Enterobacter and Serratia infections are clearly related to hospitalization أكثر من Klebsiella, especially due to the invasive procedures زي ما حكينا مثلا IV lines, respiratory intubation, urinary tract manipulation, Foley's catheter, كل هالأشياء. So, in addition, outbreaks of Serratia pneumonia have been associated with contamination of the water in the respiratory therapy devices. هاي مين تاني دائما نشوفها كنا نحكي عنها Pseudomonas. Okay. Prior to the extensive use of these procedures, Serratia was a harmless organism. لما صرنا نعمل هذه البروسيجرز أكثر صارت Serratia أكثر مهمة. It can cause endocarditis in users of drugs. Pathogenesis of the septic shock راح يكون شو endotoxin. This is the typical endotoxin shock producer of gram-negative rod. Lactose fermentation هذول obviously they are lactose fermenting colonies. راح يعطوك acid on TSI, NOH2S, citrase positive, indole negative. E. coli citrase بالعكس راح تكون citrate negative, indole positive. هاي كثير مهمة. Indole positivity for E. coli is commonly used. So عشان نفرقهم عن E. coli هذول بستخدمهم citrate and indole. تمام. Treatment هاي نقطة كثير مهمة. عندنا high antimicrobial resistance sensitivity testing must be done. You have to do sensitivity testing. ما بتقدر تعطي بس العلاج وتتركه. You have to know what you're dealing with because you need to destroy this organism as quick as possible. ما تعطيها chance to become even more resistant. So carbapenem resistant strains are an important cause of hospital-acquired infections and are resistant to almost all known antibiotics. كتير شفت أنا جمعت عينات كتير of pan resistant Klebsiella ما عندها sensitivity ضد أي شيء. يعني you can see this وأكتر بالدول الشرقية زي دولنا مثلا الهند مشكلة عويصة كتير لأنه الناس عندها access للأنتيميكروبيالز بدون طبيب يعطيهم الأنتيميكروبيالز. and then في عندك مشكلة مثلا بالأكل وبالهذا بصير عندهم بدخل antimicrobials بالأكل بصير الناس عندهم high resistance of antimicrobial. حتى مثلا الكاربابينم resistant هذا طلع من الهند بالبداية. So عادة amyloglycoside مع cephalosporin حكينا this is an empirical treatment عن عبين ما يجيك الريزلت. So beta lactam with amyloglycoside. بالنسبة للانتيروبacter infections combination of epipenem and gentamicin is used. They like catheters, so changing the catheters will obviously prevent this pathogen. آخر إشي Pseudomonas. Pseudomonas aeruginosa causes sepsis, pneumonia, and urinary tract infection. It is the most common cause of ventilator associated pneumonia. شو أشياء نعرفها عن Pseudomonas الآن؟ نعرف إنها it's an obligate aerobe. It's an oxidase positive organism. بتحب المية حكينا مثلا تشوفوا مثلا المية مثلا water fountains ومثلا حنفية المي دائما حواليها مثلا this green خاصة اللي ما بتتنظف تضلها فترة طويلة عليها مية. You can see this green زي تجمعات لونها أخضر. This usually probably is Pseudomonas because of the green pigment cyanoberdin that is produced by this organism. So they are strict aerobes نعرف عليهم. So they are strict aerobes, oxidation of sugars rather than fermentation. So they are oxidase positive. They are able to grow on water. بيحبوا المي كتير. مين عندنا وين بنستخدم المي إحنا بالهوسبيتال in مثلا ventilators. So they are the most important property, the most important infections موجود إحنا بنشوفه بالventilator acquired pneumonia. هلا مش بس مشكلة بس هذا Pseudomonas كمان تقدر تعمل other infections. So the main thing اللي هو هذا اللون الأخضر تعمله this is the biofilm formation. So it's very resistant to disinfectants to the biofilm formation. So that is the extremely important property. تحب المية تحب الهواء and produces biofilm. So produces two pigments حكيناهم اللي هو pyocyanin and pyoverdin which is هذا اللي بعطي اللون الأزرق بالبس and pyoverdin was a fluorescent is a yellow green pigment that fluoresces under UV light and this can help in the early detection of skin infections in burn patients. ليش burn patients؟ مية، في مية وفي هواء. وين المية؟ سيرم بيطلع من البيشنت هذا المية عادة مثلا، فيهم بنتقل عليه الهواء. كمان this is a very problem second big problem للسودوموناس اللي هو skin infections with burn patients. الأولى كانت ventilator acquired pneumonia، الثانية burn patients. In the lab, these can diffuse into the agar and give you the blue color or the blue-green color, which is useful for identification. It's the only species of Pseudomonas aeruginosa that synthesizes biocyanine. فما راح تشوف اللون الأزرق إلا بالأرجينوزا. هايو اللون مبين، هذا اللون الأخضر تبع البايوفيردن. Clinical findings can cause infections virtually anywhere in the body. أهم إشي اللي هم الwound حكيناهم البيرنز، pneumonia, ventilator acquired, and cystic fibrosis patients. Very important. And then you have the common urinary tract infection, especially in the hospital as well. So, هاي النقاط. It is an important cause of hospital-acquired pneumonia, ventilator-associated pneumonia, cystic fibrosis. You have wound infections, especially burns, and then urinary tract. مية هواء دائما في مية وهواء مع بعض. Patients with Pseudomonas aeruginosa sepsis have a mortality rate greater than 50%. That is why we كنا نتذكر كنا نحكي مثلا بأن أنتي سودوموناس دراج تكراسيلين بيبراسيلين وكيفالوسبورين هدول بس للأنتي سودوموناس. كنا نحكي بالتيبل تبعت الأنتي ميكروبيلز we have the special drugs كانوا مثلا سودوموناس والأنايروبز والTB مثلا, because the Pseudomonas has such a huge problem on the mortality rate. If you have some Pseudomonas a patient, probably have a very high mortality rate. That's the problem with Pseudomonas. So malignant otitis externa هاي من النقاط اللي مثلا sometimes doesn't make sense. The outer open or outer lining of the ear, the external ear, عادة patients who swim مثلا in an area where in a swimming pool or a hot tub, they might have a break in the skin in the outer ear. In the pinna of the ear or the outer ear, they might have severe external otitis, which can be fatal. This is a problem أحيانا. ecthyma gangrenosum لطلاب الطب نحكيها أكثر هذه بالفصل القادم. So this is عادة a typical skin lesion caused, necrotic skin lesion caused by Pseudomonas. For the lab, تذكروا Pseudomonas هي كانت تعطي أزرق أحمر. Doesn't, so oxidase positive, does not ferment any sugars, فبتعطيك شو كله أحمر على so basic على الأسيد and على السلاند and the butt. So diagnosis: Pseudomonas grows on non-lactose fermenting colonies, oxidase positive, typical metallic sheen on DSI agar coupled with the blue-green pigment can give you sufficient data to make a diagnosis. Another thing عادة بيحكوا it has a fruity aroma. If يعني إذا بتشمها مرة بتعرفها. So it has this يعني specific aroma for it. Treatment زي اللي حكينا بما إنه they have their own drug choices because of their high resistance to many antimicrobials. We have specific treatment كانوا زي ما حكينا for Pseudomonas alone. So that's why زي Klebsiella بدك تعمل sensitivity test so you can get rid of it as soon as possible. And that's why we have anti-pseudomonal penicillins مثلا piperacillin, tigracillin مع أو بدون tazobactam or clavinate plus aminoglycoside عادة amikacin or gentamicin. This works for highly resistant strains. You will have to use colistin زي ما تذكروا حكينا محاضرات الانتيميكروبيالز. UTI, Cipro. Catheters must be removed, changed, special care, hygiene in burn patients, very important. This was all you will see as a عادة استخدام الهايجين بالburn units is mainly to prevent Pseudomonas. If Pseudomonas happens, you will have a problem with a patient who has lost a lot of fluids and lost a lot of proteins, lost a lot of immunoglobulins in the burn. بعدين بصير عنده Pseudomonas, so that's a very big problem. So UTI, burn patients, pneumonia, highly resistant, biofilm formation, and then oxidase positive and obligate aerobe. And that's the story of Pseudomonas. Oh, this is where we stop. We finish the gram-negative enteric rods.